everyone, my name is Revneet and I greet you all today with the hope to raise awareness about hand hygiene within medical imaging departments. Have you ever had an X-ray examination before? Do you remember if the radiographer cleaned the equipment before or after imaging you? What if he didn't? What if the patient before you was infectious and the equipment was left uncleaned? What if you were the infectious patient? How would you feel if the person being imaged after you received infectious agents that you may have left there? Now imagine the radiographers cleaning the entire department after each examination. How many patients would they actually be able to image in a day? Let's put this into a practical scenario. Let's preset some zones within the department and consider a common imaging examination. So one radiographer performs the entire examination of an infectious patient. His role is to interact with the equipment and the patient for appropriate positioning, which we will call Zone A. He is then required to cross the boundaries between Zone A and Zone B to take the image. The radiographer may be required to cross these boundaries between Zone A and B multiple times during the examination for additional images. He sanitizes Zone A after the completion of the examination. However, Zone B was left uncleaned, as those objects did not come into direct contact with the patient. He washes his hands before heading to the workstation, which is Zone C. The radiographer crossed the boundary between Zones A and B without cleaning or sanitizing prior to crossing, causing cross-contamination. Zone B was also left uncleaned, and increasing the risk of infection spread as the microorganisms transmitted by the hands of the radiographer were not removed. Now, the question is, did we preset the zones accurately? Should we have merged Zone A and Zone B and classified them as one, and then the entire area cleaned at the end of the examination? This study aims to observe radiographer movements within the department during patient examinations to identify when the preset zones are crossed by staff, potentially spreading infectious agents into the outer zones. This will assist in discovering the accuracy of the preset zones and the effects of inaccurate zone allocation on current hand hygiene guidelines and infection control methods, with an aim to reduce healthcare-associated infection and improve patient care services, so that when you go for your X-ray examination, you can be confident that any objects and equipment coming into contact with you or anyone else is clean and free of germs. Thank you for listening.